Hi, Don here. Welcome to Podiatry Practice Mastery, where I'm trying to bring your office to the $1 million mark and beyond. In this episode, I want to talk about a patient experience with shockwave, and specifically this patient, she had a Haglund's deformity. So let me tell you kind of the story. She had bilateral Haglund's. A few years ago, I did a right Haglund's repair. So I did the speed bridge procedure, kind of removed the bump, reattached, and she had kind of a long recovery with that. That was the right side. And then this time I did the left side. Now, prior to doing it, I said, hey, we should do some shockwave to maybe see if we can reduce the swelling, because very frequently if patients have Achilles tendonitis, or if they'll have like the Haglund's, that swelling around the bump, I'll do shockwave and that'll calm down the bump and make it feel better. In her case, we did a series of 3 shockwaves. I did 3 radial shockwaves, and then I was starting to do a session of focused, and she just said she was in way too much pain and she wasn't able to handle it. She was in pain all the time. It was just kind of beyond that what she could handle. And so then for the left side, we decided to do the surgery. And so we went in to do the surgery, had it scheduled. She was swollen, painful all through the time. And then when we did the surgery, what I found was unique is that there was so much hypervascularity in the area of the insertion of the Achilles that I'd never seen before. And I think it was due to the shockwave, because when we talk about shockwave, we say that it increases blood flow to the area and neovascular genesis, like new blood vessel formation. And so as I made the incision, I just saw like all this beautiful blood supply there. It wasn't enough to heal her condition, her pain, because she had a really big spur. So I shaved down the spur and I reattached it. And what she said to me when I saw her recently, this is her 6-week follow-up. So she's 6 weeks into it. I kept her in a posterior splint for 2 weeks, and then I transitioned her with a boot with a knee roller for another 4 weeks. And she said to me her recovery was like 100% better than the other side. And I don't know if I was 100% better surgeon the second time, or the resident was 100% better, but she was 100% better. And so the conversation in my head is, was it that shockwave that helped the recovery process? Because I remember when I went to one of these shockwave courses, they gave this sort of example slide, which I don't have, and I requested it because I want to include it in my presentation. But they did shockwave prior to doing like a plastic surgery, like a tummy tuck type of a procedure. They made that kind of incision on the bottom underneath the belly button, and they did shockwave only on half of it, and they didn't do shockwave on the other half. And then post-surgically, you could just really see the difference in the scar. You could see the improvement in the tissue and things like that. So the thought is, how can we start incorporating this, or how can I start incorporating shockwave pre-surgically for patients? Certainly we try to avoid surgery, but sometimes surgery is necessary for them. And in this case, it worked out really well. So the thought I have, and I was reaching out to some people that do similar things, or they do shockwave, is that I do a pre-surgical discussion 30 days prior to seeing a patient. And that's where we kind of sign the consent, go over any questions that they have. I prescribe the medications, and that kind of brings me to a level 4 visit, go through everything, sign the consents. And then the thought is doing a few sessions of shockwave prior to kind of speed up the healing afterwards. And I think they would have a better surgical outcome. And I'm not exactly sure, like, if I would do it on everyone or just like the Haglund's. Maybe you could do it on a bunion. I don't know if you could do it on a hammer toe. I'm just kind of thinking out loud here. Maybe the hammer toe would cause less swelling afterwards, because I know that's a big challenge with hammer toe surgery. So I'm going to share kind of what my thoughts are in terms of what I was thinking about doing here. And it's using my patient presentation. So if you haven't seen this patient presentation, you'll be able to see it right now. If you're listening to it, sorry, you can go to patientpresentations.com, and then you can download. Not download, it's just really just a website. Okay, so it's going to pop up here. It's going to be a pre-surgical discussion. And what you're going to see here, these are the same slides that I go over with patients prior. So I'm not going to go over all the slides. I'm going to go over kind of the where I'm going to add in the shockwave. So with my pre-surgical discussion, I kind of talk about some of the main questions that patients have with surgery. I talk about kind of what are the reasons I do surgery. I talk about what they should expect prior to surgery. And this is something that I always do 30 days prior to surgery for the patient. You can see here the reasons for surgery: skin breakdown, pain, can't find a shoe, the non-surgical treatments, kind of what we tried, imaging, any imaging studies. I do this just as kind of a safeguard if I needed to order some other type of images. I talk about the surgical questions they have. How long is my incision? How long will surgery take? What's my recovery? How long will be off of work? When can I start working out? When will this come back? What medications I should stop? And then I added this one. So this is my like first rendition here of starting to do more shockwave pre-surgically. What can I do to improve healing? I know I've heard of different things that people have tried. I've heard of people talking about they sell vitamins to patients post-operatively to help recovery. I'm not sure if they work. I just didn't feel comfortable selling things like that, but I think the shockwave does have some validity to it. So what can I do to improve my healing? So certainly I would talk about like not smoking if you smoked, kind of staying off your foot. But then I put a slide in here talking about shockwave. So shockwave, these treatments right here, they do these things. So they stimulate growth factors, so neogenesis of vessels. And most likely what I would do is I would share this experience of this patient with the bone surgery and how she had a quicker recovery from it and just a lot less pain. They stimulate stem cells. They stimulate microcirculation. And you don't need, I don't tend to focus on these other things, antibacterial effect, but this is where I would kind of throw the shockwave in. So my thought is, let's say they would have surgery a month from now. You could set up like 2 to 3 sessions of shockwave prior to have them have a better, quicker recovery post-operatively. So that is my idea of doing this. And then I also talk about before surgery, during surgery, anesthesia, after surgery, medications. So you can use this if you think this would benefit you. I talk about some of the surgical complications and then really the swelling and stuff like that. Maybe this would help with surgical swelling and scarring, especially on lesser digits. So that's kind of my idea with this would be doing that for surgical patients to avoid complications. Not sure. I wanted to get your thoughts if anyone else has been doing this or you thought about doing this. But I think this would be another method. Now, I do not do a lot of surgery. I can avoid doing a lot of surgery with shockwave. But I think for those that need surgery, would benefit from surgery, this would be an option. I've had some other people as well. They've done it for wounds. So it'd be another reason to do it for wounds as well. So anyway, let me know your thoughts on this. Send me an email, donna@podiatrypracticemastery.com. Once again, hope you found this beneficial. My goal with this podcast is get you to the $1 million mark and beyond. If you feel like you'd like some more help, I'm working on something now, some like asynchronistic coaching. So kind of we'd work together in a small group with other people that are interested in improving their practice. I'm doing a test session right now and it's going well. And if you're interested in that, go to Podiatry Practice Mastery. You can see some information on how to apply to see if you're a good candidate. Okay. Thanks, guys. Have a good day.